Hello, everyone. My name is Lauren Gresham, and I'm a medical student.
Hi, my name is Omar Asfi. I'm a medical student.
And today we're going to be talking to you about glycocalyx production by Staphylococcus epidermidis in patients with a dialysis catheter. So, just a little background on this topic. Staph epidermidis is a leading cause of nosocomial bloodstream infections, especially in patients with central venous catheters. Only a small percentage of positive staph epidermidis blood cultures are thought to represent true bacteremia, as it's a common contaminant. I'm sure we've all seen this in a clinical setting. And although these infections are somewhat uncommon, they do have a pretty high mortality rate, might be up to 13.6%. So clinicians continue to look for ways to correlate positive staph epidermidis blood cultures with true pathogenicity so that they can determine which patients actually need to be treated. Glycocalyx production has been previously shown to correlate with pathogenicity in the staph epidermidis endocarditis model, and the tryptophan assay for cell-adherent hexoses has been shown to quantify glycocalyx production in the laboratory. So as far as our question for this experiment, we wanted to determine if there was a statistically significant difference between glycocalyx production and staph epidermidis blood cultures in patients with dialysis catheters and in patients without dialysis catheters measured by the tryptophan assay. So our approach to this experiment, 29 isolates were collected from patients with positive staph epidermidis blood cultures at the Medical College of Wisconsin and the University of California, San Francisco. The isolates were divided into two groups based on their clinical characteristics. Group 1 consisted of 10 isolates that were judged to be clinically insignificant contaminants in patients who did not have a catheter in place. Group 2 consisted of 19 isolates that were judged to be clinically significant in patients who did have a dialysis catheter in place. Glycocalyx production was measured by the tryptophan assay to determine if there was a statistically significant difference in the spectrophotometric measurements between the two groups, and the tryptophan assay was performed at the Medical College of Wisconsin.
So as you can see from the results, the mean absorbance value was 0.211 for group 1 and then 0.27 for group 2. Data analysis was performed with the Mann-Whitney U-test, which found a statistically significant difference between the means of group 1 and group 2 with a p-value less than 0.05. And looking at the graphs, we can see the difference is pretty significant between the two groups. In conclusion, this study demonstrated a statistically significant difference between tryptophan assay absorbance values for group 1 and group 2. Therefore, staph epidermidis isolates in patients with dialysis catheters in place produce more glycocalyx than in patients without dialysis catheters in place. This assay may be helpful in predicting pathogenicity of staph epidermidis in positive blood cultures. As far as limitations to the study, this assay should be further studied with a larger sample and other catheter types to demonstrate its true predictive value. Further experience with tryptophan assay is needed to determine its sensitivity and specificity. That concludes our presentation on this topic. We do want to thank Dr. Dahl for mentoring us through this project, and also we would like to make a note that we have submitted our data to the Journal of Clinical Microbiology. Thank you for your time and attention.